latest Ebola patient arriving in America for treatment from West Africa. He is a surgeon with U.S. residency and believed to be sicker than anyone else who has been successfully treated here in the U.S. He's now at a special hospital in Nebraska for people with that virus. And ABC's Lindsay Janis is here with the story. Good morning, Lindsay.
Good morning, Paula. Dr. Martin Salia's condition is described this morning as extremely critical. He's expected to be joined by his family in Nebraska, where he has become the 10th person to be treated for Ebola in the United States. Emergency crews in full hazmat suits transferred Dr. Martin Salia from a special medically equipped aircraft to this protective bubble-enclosed stretcher called an isopod. First, lifting the surgeon onto a flatbed truck. Once he arrives at Omaha's Nebraska Medical Center, the 44-year-old taken into the hospital still tightly sealed. No bold display of walking into the hospital as Dr. Kent Brantley did when he began treatment for Ebola after returning from Africa. Overnight, the hospital downgrading Dr. Salia's condition to extremely critical. Even before receiving him, the facility, 1 in 4 in the country with specialized biocontainment units, described him as possibly sicker than the first patients successfully treated in the United States. The reality? The risk of infection to those treating him skyrockets. Overnight, a spokesperson saying medical staff are rested and ready. Speaking to ABC News Friday, Dr. Salia's son, Mata, was hopeful.
He's a very strong guy. Emotionally and physically, he's strong. And I have no doubt that he will come out victorious.
Dr. Salia lives with his family in Maryland, but spends much of his time in his native Sierra Leone, where he is chief medical officer at a United Methodist hospital in Freetown. His son says he knows exactly what he'll say to his dad when he sees him.
Dad, you are my hero, and you'll always be my hero.
Dr. Salia's wife, a U.S. citizen, requested her husband's medical evacuation, agreeing to reimburse the U.S. government for the cost, believed to be around $215,000. Well, overnight we spoke with a representative for the United Methodist Church, and she told us they were in the process of setting up a fund so they could collect donations to help cover Dr. Salia's medical costs. Paula?
Thank you very much, Lindsay. And ABC's chief health and medical editor, Dr. Richard Besser, is here with us this morning. Good morning, Rich. And first and foremost, in regards to Dr. Salia's condition, we saw from that video, he did not walk off the plane, as we've seen from some of the other patients treated here. He's now in extremely critical condition. What does that say to you?
Yeah, although 8 of 9 people who've been treated here have survived, Ebola is a deadly disease. Extremely critical means his vital signs are not stable. So whether it's his breathing or his blood pressure, he's in very, very difficult situation.
And we should stress that he was not treating Ebola patients there in Sierra Leone. And the first time that he was tested for Ebola, it came back negative. So what does that say about the disease?
Yeah, I mean, in reality, those people who are not working in treatment units or working in general hospitals are at greater risk because they're not wearing all that gear, and they don't know whether a patient who's coming in labor or someone with pneumonia actually has Ebola. And the fact that his test was negative early on, you'll see that because the level of virus in the blood can be very low, and the early tests can be negative.
Everyone wants to know about containment. You've been to West Africa twice, the epicenter of this crisis. So how close are we to containment?
Yeah, there have been some reports that in Liberia the situation is getting better, but the big concern is that there'll be complacency, that people will let off on what needs to be done to get this really under control. Sierra Leone, it's raging out of control. In Liberia, they can't let up. They have to see the progress continue.
They have to stay vigilant. Dr. Besser,
That's right.
Thank you so much.